I'm Erin Salinas, one of the gynecologic oncologist pelvic surgeons with Compass Oncology. And today I just want to tell a story about one of my friends that has a genetic mutation that puts her at an increased risk for cancer. I know you guys are all thinking that I'm really good friends with Angelina Jolie, but I'm not. This is actually about my friend Jill, who gave me permission to share her story. So genetic testing helps identify cancer risks for her entire family. Jill knows the importance of timing and tough decisions. She credits both with helping doctors find an ovarian tumor early and getting her on the path to further reducing her risk of cancer. In 2011, during a gynecology visit, Jill was talking with her doctor about her family's cancer history. Her mother had died of breast cancer at the age of 64, and her grandmother had had ovarian cancer as well as colon cancer. Jill's gynecologist suggested that Jill consider genetic testing to determine whether she was at risk for cancers too. Jill says, at the time we didn't know if insurance companies could drop you if you were found to be at risk for something in the future and had too many unanswered questions. So they decided against the testing at that time in 2011. 3 years later, the subject came up again. By then, genetic testing had become more widely recognized as a valuable tool in health management, and laws were in place to protect patients. In addition, her brother had been diagnosed with aggressive stage 4 prostate cancer under the age of 50. Jill decided to have genetic testing done. She first saw a genetic counselor, which is usually the first step in management for patients considered to be at risk for a genetic mutation, putting them at high risk of different cancers. So the first step was she saw a genetic counselor. She then underwent genetic testing and tested positive for a BRCA2 or a BRCA2 mutation. The BRCA2 gene produces tumor suppressor proteins that help prevent cells from growing and dividing too rapidly or in an uncontrolled way. A mutation of this gene means that the cells are more likely to form a tumor. About 1 in 300 to 1 in 800 individuals in the general population carry a mutation, and approximately 10% of cases of ovarian cancer and 3 to 5% of cases of breast cancer are due to germline mutations in either BRCA1 or BRCA2. And the lifetime risk of breast cancer is as high as 65 to 74% in patients with these mutations. And the lifetime risk of ovarian cancer is 15 to 40% compared to just 1.3% in the general population. So Jill said the BRCA2 diagnosis starts a whole series of evaluations with lab testing, imaging, and consultations with tons of different doctors about options to address the risk associated with your mutation. These are some of the visits that she went to go. There's different things that different providers can offer patients. The two main cancers in BRCA mutated patients are ovarian cancer and breast cancer. In ovarian cancer, there's oral contraceptive pills that you can take to reduce your risk. There's also increased screening with ultrasound and CA-125 levels in patients found to have these mutations. Or you can undergo a risk-reducing surgery, meaning removing the tubes and ovaries to prevent cancer when a patient is done childbearing. As far as breast cancer, there's the same sort of options for enhanced screening with MRIs and mammograms, as well as risk-reducing surgery that would be a mastectomy. So Jill and her husband Dave were concerned about the results and what implications they could have for them and their immediate and extended family. Even as Jill started going down this path, we had to think about it. Those implications could be fairly far-reaching at some level, her husband says. Would we share the results with our family members? Would we keep it to ourselves? Even if they say they don't want to know, if you go through those procedures, they're going to know something's up. Children of BRCA2 mutation carriers, as well as BRCA1 mutations, and their siblings each have a 50-50 chance of testing positive. Because genetic testing in a family member can identify the exact chromosome, it can simplify the testing in family members. Jill was also referred to a gynecologic oncologist, which is what I do, to determine if she would be a candidate for risk-reducing surgery. And she did. She elected to undergo a minimally invasive, we do robotic surgery, laparoscopic surgery. She had a robotic hysterectomy, as well as removal of her tubes and ovaries. At the time of surgery, she was found to have an early stage ovarian cancer, which happens in the minority of times. A lot of times, ovarian cancer, about 75% of the time, is caught at a later stage, and about 25% of patients, it can be caught at an earlier stage. Jill was lucky, and her cancer was caught early. Additionally, there's no great screening for ovarian cancer, but for patients like Jill who have a family history, we can do tests for these patients, including ultrasounds and CA-125 levels, which is a blood test. She was also connected to a breast oncologist and a breast surgeon. She was started on tamoxifen, which is a medication to help reduce the risk of breast cancer, and she ultimately ended up undergoing bilateral mastectomies to prevent her risk of breast cancer. At Compass Oncology, we not only have gynecologic oncologists, but we have breast oncologists, breast surgeons, as well as medical oncologists to help guide patients through all of these different tests and conversations. We also have genetic counselors at each of our different sites to also initiate the process for our patients. Per Jill, she said a benefit of making the tough decisions of testing and surgery. Jill says that her extended family has become more aware of the risk and can make informed decisions about enhanced surveillance, chemo prevention, and prophylactic surgeries. Since her own diagnosis, Jill says 9 family members have been tested and 4 have been found to be at high risk. Having a BRCA mutation is very difficult news to learn, but we have decided to consider this knowledge as a blessing rather than a curse, and our hope and prayer is that others in our family can also be able to eliminate or have early detection of hereditary cancers as well. And so I wanted to share Jill's story for a couple reasons. One, to not bore you with too much scientific stuff, but also to kind of outline the steps that she went through, first starting with genetic counseling and then having the surgery to have her ovaries removed that ultimately found an early stage ovarian cancer, as well as then deciding to undergo the bilateral mastectomy. At Compass Oncology, again, we have genetic counselors, gynecologic oncologists, breast surgeons, medical oncologists that can help patients at increased risk throughout the entire process. And one more syndrome that I did want to touch on, there's another one called Lynch syndrome that increases the chance of uterine cancer, ovarian cancer, and colon cancer. So if any families have a large number of family members with these specific cancers, it's definitely good to bring it up to your primary care physician or whichever physician you're seeing. So what to do? Know your family history if at all possible, and discuss your family history with your doctor. Genetic testing can help identify cancer risk for an entire family. For more information regarding genetic counseling, genetic testing, risk-reducing surgery, to decrease your risk of ovarian or breast cancer, please visit compassoncology.com.